Hannah. Today we're going to analyze infectious disease outbreaks across healthcare institutions in Toronto during the first 3 months of 2026. This project is presented through an interactive Tableau dashboard that looks at outbreaks trends over time, compare different healthcare settings, and highlight the most common causative agents. The data used for this analysis come from the City of Toronto Open Data Portal and includes outbreak records from long-term care homes, retirement homes, and hospitals. The overall goal of this dashboard is to make outbreak data easier to understand and interpret. It focuses on three main questions: how outbreak activity changes early in 2026, which healthcare settings were most affected, and which pathogens were responsible for the majority of the outbreaks. The dashboard is organized from top to bottom. At the top left, we see the total number of outbreaks, which is 233 cases during this time period. This gives immediate context for the scale of outbreaks activity. Key insights are summarized so a decision maker can quickly understand the most important messages without analyzing every chart. So starting with the first visualization, this line chart shows the number of outbreaks reported between January and March of 2026. One of the most noticeable pattern here is that January has the highest number of outbreaks, followed by a drop in February and further decreases in March. This suggests that outbreaks activity was more concentrated early in the year. This aligns well with typical winter respiratory virus patterns. The downward trends as we move into February and March may be influenced by several factors. These can include seasonal changes, outbreaks being brought under control, or strengthened infection prevention measures and institution respond to earlier spike. The next visualization breaks outbreaks down by healthcare setting. A bar chart is used here because it allows for easy comparison between categories. Here we can see long-term care homes experience the highest number of outbreaks, followed by retirement homes and then hospital care setting. This pattern is not surprising. Long-term care and retirement homes involve shared living environments and residents who are often older or have underlying health conditions, which can increase vulnerability to infectious disease and make outbreak harder to contain. As you can see, in contrast, hospital shows fewer outbreaks overall. This is likely related to stricter infection prevention protocols, routine screening, and better access to isolation spaces and protective equipment. So, in comparison, highlight shows how outbreaks risk vary significantly depending on the type of healthcare environment, and it reinforces the importance of target infection prevention strategies, especially in congregated care setting. The next section of the dashboard focuses on the causative agent responsible for the outbreaks. These results shows that respiratory viruses dominate the outbreak landscape across healthcare institutions during this time period. COVID-19 appears to be the most frequently reported pathogen. Enteric outbreaks such as norovirus appear much less frequently but are still present. There's also a category labeled unable to identify, which represent outbreaks where a specific pathogen could not be confirmed through laboratory testing. This highlights a limitation that can exist in outbreaks data and emphasizes the importance of timely testing and reporting. So overall, these findings emphasize the importance of strong infection prevention and control measure, especially in long-term care and retirement care facility. So this dashboard helps us visualize and by presenting outbreaks data in an interactive way, it helps transform complex records into insights that can support public health monitoring and planning. This concludes my analysis for healthcare outbreaks in Toronto for 2026. Thank you for watching.